Hello, everyone. Thank you for joining us. On behalf of the Southeast MHTTC, we want to welcome you to today's training, Foundations in DBT Therapy. We are pleased to have Dr. Green, who will be facilitating this series for us. And without further ado, Dr. Green, I'll turn it over to you to start the training.
Good afternoon, everyone. Thank you for spending your lunch hour with us. We're going to talk for the next hour about some of the foundational aspects of DBT. DBT is complicated, and so by the end of this hour and by the end of the 4 weeks, you will probably not be a fully trained DBT therapist. It takes a lot of consultation hours and a lot of practice, both with clients, but also with yourself. But what I am hoping that you will have are some skills that you can apply pretty readily to the varying environments from which you are joining us, some skills that you can use for clients who would be considered clients appropriate for DBT, and also clients who don't necessarily fit the profile. One of the things that I really enjoy about DBT is how practical it is, and its emphasis on effectiveness. And all of our clients, and as well as us, can use skills for being more effective in our lives. So that is what we're going to be doing. We are going to be working on giving you skills that nurture effectiveness for your clients. I am Dr. B. Nalaja Green. I'm a licensed clinical and community psychologist located in Atlanta. I'm an adjunct professor for Emory, a facilitator for the MHTTC, and I'm also the founder of Standpoint Wellness, which is a boutique integrative mental health care practice in North Fulton, and I'm excited to be here. So I want to just get a sense of who is in the room in terms of your level of familiarity with DBT. And so there is a poll up, just kind of asking where you are on the continuum. Okay. All right, so it looks like most people in the room have limited experience, some formal. We have a couple of expert level folks, and at least one person that has no familiarity. Well, everyone is welcome. And for the expert in the room, please, if I miss something, let me know. I will try to cover as much as I can. So today we're going to do some talking to each other. I'm going to probably do most of the talking. If you have questions, please drop them in the chat. The chat is being monitored, and I will try to answer them as we go along. If I don't get a chance to answer them while we're talking, I will leave time at the end to answer them. If for some reason I don't get a chance to do it then please feel free to email me or to email MHTTC, and they will get those questions to me, and I will try to answer them as well as I can. After this, you will also receive an email that has your homework. DBT is famous for homework, and also some recommendations. And so I'm going to invite you to kind of be on the lookout for that. You also should have handouts. If for some reason you don't, just let us know in the chat, and we will make sure to send some handouts your way. So I am going to go ahead and share my screen, and we will get started. All right. All right, so I have already told you who I am. I also, just to give you a sense of kind of my training in DBT, I worked for many years on the military sexual trauma team at the VA, which welcomes many clients who have been diagnosed with borderline personality disorder and who were funneled to our DBT track. So I have a lot of years of working with clients and also in consultation groups on DBT. So today, I'm going to introduce the overarching effectiveness framework. Remember, DBT is really about teaching our clients to be as skillful and effective in their lives as possible. So we're going to begin that conversation. I'm going to introduce the 5 options for responding to a problem, also introduce mindfulness principles, introduce the how and what skills of mindfulness, as well as introducing the 3 states of mind. DBT is broken up into modules, which are collections of skills that are grouped together in order to achieve a particular goal. Those modules are mindfulness, emotion regulation, distress tolerance, and interpersonal effectiveness. And we'll talk a little bit more about those modules. And so that is also how this training is broken up. We're going to spend our time today talking about some of the foundational pieces of DBT, and we're going to move into talking about mindfulness so that you are also kind of following that same structure. Mindfulness is really the foundation of all of the other skills. And we'll talk a bit more about why that is true once we get into what mindfulness is. When we talk about DBT, we're talking about dialectical behavioral therapy. And dialectical behavioral therapy takes as its base what's called the biosocial theory. The biosocial theory recognizes that there is an interplay between biology and biological vulnerability and biological tendencies and environments. And so there are those of us who may be born with certain biological vulnerabilities to emotion dysregulation. Now, we may grow up in environments with caregivers who are very responsive to our emotions, who help us label and identify our emotions, who teach us skills for managing anger, managing sadness, who encourage the expression of emotions. We might also grow up in environments that are actually quite invalidating, that ignore our emotions, that minimize our emotions, or that are traumatic or abusive. And so in DBT, you will hear the term invalidating environment a lot. An invalidating environment really speaks to environments that are misaligned with the emotional tendencies of the children that eventually become adults and eventually become our clients. And so biosocial theory says that when we see clients, we're seeing part biology and part environmental influence. Our job as clinicians is to create a validating environment for many clients who have really experienced invalidating environments. When we understand this framework of invalidating environments, we can also understand many of the behaviors that we see in terms of adaptation. And so when we think about skills and behaviors in DBT, we are often thinking about the framework of effectiveness and recognizing that behavior is not random. It comes from somewhere. So a child who is 3 and is in an environment where their emotions are validated and recognized and treated with validity and credibility, that child might feel comfortable expressing their emotions, and they might grow up in a way where they're able to manage and balance and regulate their emotional well-being. A child who grows up in an environment where they are ignored much of the time, or they don't get attention until they are yelling and screaming and throwing and breaking their toys, that child may learn that in order for them to be seen, they have to amp up their behaviors. Now, in a 3-year-old, yelling and screaming and breaking your toys, that might seem developmentally allowable, but not for a 16-year-old, not for a 25-year-old, not for a 35-year-old. By that time, you're probably going to jail or at least getting into a lot of trouble. But if we're able to see those behaviors as having been developed as an adaptation, right? The 3-year-old was adapting to its environment. And so if the 3-year-old needs attention and it learns that if I do these behaviors, I get the attention that I need, that reinforces that pattern. And so what happens is the 3-year-old grows into adulthood and the behaviors that used to be adaptive are no longer. And so we want to see behaviors through the lens of effectiveness, ineffectiveness, adaptation, maladaptive, kind of in those ways. Not in an inherent way that a person is maladaptive, but a skill can be maladaptive. At the base of our work in DBT, we talk a lot about emotion dysregulation. Often, the folks who are enrolled in DBT programs have been diagnosed with borderline personality disorder. But everyone who can benefit from DBT hasn't necessarily been diagnosed and won't necessarily be diagnosed with that disorder. But emotion dysregulation really forms the underpinning of many of the challenges and problems that our clients show up with. Emotion dysregulation is really the experience of having trouble managing one's emotions in ways that are effective and helpful. And Not being able to do that can actually have a pervasive impact on functioning, beginning with one's ability to have a coherent sense of self. If we think about the functions of emotions, emotions are communicators. They communicate to us. They also communicate to other people. They also help us to organize our behavior. If we are not able to read those signals correctly or read those signals well, it can be difficult to tell what we like, what we don't like, what our boundaries are, where we end and another person begins. And so the sense of self can be compromised because we are unable to manage our emotions in ways that are effective. Many of us have the experience of changing or adapting our behavior depending on the context that we're in. So for many of us, there's language that we might use with our friends at home that we won't use at work. There are ways that we might dress in certain casual environments that we wouldn't in other environments. And often we see these things, if we have a coherent sense of self, as just kind of part of the way of navigating society effectively. But if you don't have a coherent sense of self, these adaptations can actually look more like I am changing myself in order to fit in to another environment, or I'm changing myself in order to have someone else's approval. And that's a bit different. And so really what we're talking about with lack of coherent sense of self is changing or not having a coherent sense of identity. Difficulties with emotion regulation also make it hard to access problem solving. If my emotions are often at an 8 or a 10 on a 1 to 10 scale, then I'm often in a place of panic or rage or fear. I am beyond my place of learning. I am beyond my sphere of being able to organize and plan. And so we want to help our clients maintain a sense of being able to regulate their emotions so that they can do the problem solving that they need to do to make effective decisions, for example. It often can be difficult to have effective interpersonal relationships. It's hard to communicate effectively. It can be hard to hear and listen to our partners, or our friends, or our family members, or our colleagues talk to us when we are too emotionally activated. So emotion dysregulation can even interfere with our relationships. Also interferes with being able to be planful and thoughtful about our goal-directed behaviors, as well as interfering with communication. Dialectical behavioral therapy is based in the idea of dialectics. Dialectics says that there can be two things that are true at the same time, and these two things may seem opposite. This is especially important for working with clients who would benefit from DBT, because often these clients are living in a space of ambivalence. Dr. Marsha Linehan is the person who created DBT, and she actually used to be a mental health client. There were some times when she was even inpatient. And she began to recognize that there was a gap in the treatment of certain kinds of patients, some of the patients who were considered to be some of the most difficult to treat. These are patients who might say that they want to change, and then they have a lot of trouble changing. Patients who express chronic suicidal ideation, patients whose emotions really seem to be all over the map, patients who engage in chronic self-harm, where they may not necessarily be trying to kill themselves, but they are inflicting damage on themselves. And so one of the things that she started to recognize is that sometimes clinicians were too much on the side of validating and supporting the patient's experience, but not moving them towards change, which felt validating for clients, but actually didn't stop the self-harming behavior, for example. Or clinicians erred too much on the side of behavior change. Okay, let's do a plan. Let's get these goals. Let's move to the next step. And so clients felt invalidated, even though they were being given skills. And so Dr. Linehan stepped back and said, well, we might need to engage in dialectics, where we hold that these clients both need the experience of validation, which we call acceptance, and also they need to be taught skills, which we call change. And so DBT is always holding these dialectical spaces of acceptance and change. What do you see? You can drop it in the chat. When you look at this image, what do you see? Some of you have probably seen this image many times. Okay. And so most often when people look at this image, they see an elder woman or they see a young woman. What about this image? What do you see? So often when people look at this image, they see a vase or they see two faces. If I looked at this image and I said, well, this is clearly the picture of an elder woman, and that's the only thing that's true, would I be right? No. If I looked at this image and said, well, this is clearly a picture of a vase, and that's it, would I be right? No. Because these two images, while all of us are looking at the same images, we are actually perceiving something different. And this is extremely important when we think about perception and when we think about holding multiple things as true in DBT, because here we have visual examples of multiple things being true based on our perception. And so I really enjoy this quote that we do not see things the way they are, we see things as we are. Because in DBT, we are really talking a lot about perception, and mindfulness dovetails with perception very well, because our perceptions influence our judgments, and our judgments and our perceptions come from our worldviews, our own experiences, our traditions, our beliefs, our socializations. And mindfulness asks us to be very intentional about meeting the present moment as it is, without judgment, meeting the present moment with as clear of a lens as possible. And so when we hold multiple things as true, and we commit to meeting the present moment with as much clarity as possible, that gives us a really solid foundation for being able to manage circumstances and situations and help clients manage circumstances and situations in their lives from a place of values and from a place of clarity, as opposed to from a place of bias or from a place of judgment. So I want to talk about some fundamental assumptions of DBT. And I think the assumptions are really important because they not only guide the experience of the client, but they also very much guide the experience of the clinician. DBT can be really difficult work, and clients can have challenging relationships with DBT. Sometimes clients come in and they're really ready to change, and they do the homework and they utilize the skills, and a lot of the time is spent just kind of problem solving about what went well and what didn't go so well with skills. A lot of the times clients come in and they say they're ready to change, and you hit a speed bump pretty early. And then you might hit another speed bump a little bit down the road. And so it can be really helpful to have a framework for how clients think about and engage with the work. And so these are some of DBT's fundamental assumptions, although they are not all of them. I chose these because I think these are some of the most compelling. So DBT has a unique perspective when engaging with clients. This technique seeks to help clients feel more effective in their regulation of their emotions, their management of crises, and their engaging in relationships. Clients will come in with a lot of different specific goals, but we are always working from the framework of wanting clients to move and increase their effectiveness in these domains of their lives. Through more effective actions, clients are meant to feel more competent, confident, and connected to their lives. Again, no matter what the client says in terms of specific goals, we are always wanting clients to feel more confident and more competent and more connected. One of the reasons that we start with mindfulness and we continue with mindfulness throughout all of the modules is because many times clients are not very connected to their present experience. They're not very connected to what's happening externally or internally. What they are dealing with externally might really be about, for example, being triggered a lot. And when we are triggered, there is a present stimulus that is associated or becomes associated with the past event. And so a trigger is really, it's a bit of taking us out of the present moment. And so we respond to triggers from a place that is influenced by the past and not just about the present moment. So we really want our clients to be more confident, competent, and connected. Behavior is thought of and evaluated according to its effectiveness, not whether we like it or not, or whether we agree with it or not. So for example, I had a client who I worked with many years ago who used to get a lot of tattoos. And many of her tattoos were the result of distress. When she would feel distress, she would go and she would get a tattoo. So we were able to conceptualize that through the framework of self-harm, that instead of her cutting herself, she found another way to engage in pain. And so whether or not I like tattoos or don't like tattoos, whether or not I thought tattoos were a good idea or a bad idea, had absolutely nothing to do with how we talked about whether or not that particular behavior was effective or ineffective, given who she wanted to be, given the safety of her body, given how she wanted to think about herself. Consider that all behavior serves a function. It comes from somewhere. It isn't random. This is really important for normalizing client ambivalence and client experience. I will often have clients come to me and they'll say, Dr. Green, I want to change X. And we'll work together for a little bit and they'll come in maybe a month later and say, I said I wanted to change X and I end up doing this behavior, which is like more of X. How come I'm doing more of X? That's so random. It doesn't make any sense to me. And I will empathize with them around their sense of confusion, their sense of frustration, maybe even their sense of disappointment. And then I will ask them, how might this behavior make sense? Even though you said you wanted to change this, and I believe that, is there a way that you continuing to engage in this behavior actually does make sense, given the context or how you were feeling or what you were telling yourself? And that really allows clients, A, to recognize that they are doing something that isn't so abnormal, right? I have so many clients who are like, I don't want you to think I'm crazy. And so normalizing their experience helps to kind of push back against that worry. And it also allows us to move away from self-judgment and more into curiosity. And we want to lean into curiosity as much as possible. What is this about? How could this make sense? What can we learn from you continuing to engage in X, even when you say you want to stop doing X? Patients are doing the best they can, and they can do better. This is the essence of the DBT dialectic. Patients are doing the best they can. That's acceptance, right? I know that you are putting in every effort that you can, and you can do better. That's the change. That's the skill piece. Patients are always moving along a continuum of acceptance and change. We recognize this dialectic and we sit with it, with them, and hold it. And so I think about moving along this continuum without getting too attached to one or the other. So I'm not spending too much time in acceptance and no time in skill development, but I'm also not spending so much time in skill development that I don't leave room for validation and acceptance. Judging and placing blame is less effective than finding out how to change ineffective actions. When we move into judgment, when we move into blame, we often are missing the opportunity to really work on the skills, to be curious about what triggers the use of skills or even the lack of use of skills. So really paying attention to moving past blame and judgment and focusing on effectiveness. So let's think a little bit about why your clients are coming to you. And so if Stephanie is around, can give us a poll. My clients come to me because they're ready to change. They want advice or suggestions. They are suffering or they need skills. Okay, everyone says they are suffering. Oh, okay, they're suffering, they need skills. Okay. So it looks like most folks have the sense that their clients are coming to them because they're suffering. And then it seems like we are in a three-way tie with, oh no, they're suffering, they need skills, and then they want advice and they're ready to change. Isn't it interesting that not most of us believe that our clients are ready to change? I think this is really important because our clients will come to us and they will say things about why they're there. And it's our job to think critically about what is underlying those reasons for coming. So there are certainly clients who come to me who are suffering and they are not ready to change. And so while they might be in pain, they might not be in enough pain for them to be motivated enough to change. Or they might need skills, but also still kind of benefit from operating the way they're operating. So while they might need skills, they may not always want to use the skills. Or they might be ready to change and they don't know how. So they're ready to change, but maybe they either lack the skills or they're in environments that are pushing against them changing. And so maybe they are ready to change, but we also need to think about how they're going to engage in an environment that actually supports them staying exactly the way they are. They want advice, suggestions. I do have some clients who come to me and say, what should I do? And I often say to them, I don't give advice. Very rarely will I give a client advice. I might give clients feedback about what I'm thinking about a circumstance. I may observe something with them, but very rarely am I being directive in giving clients advice. And so we might think about what clients want from us and what they're ready for. So the very first skill that we want to introduce to our clients when we are working from a framework of DBT is we want to choose goals. And I think motivational interviewing is really useful here when thinking about choosing goals. And motivational interviewing kind of first came on the scene largely in the substance use world, but it has really kind of moved to other mental health interventions. And motivational interviewing is really helpful for eliciting what they call change talk. Right? How we know that a person is not only suffering, not only has some motivation, but they also have some readiness for change. And motivational interviewing really moves us into that direction of having the clients recognize their own level, their own energy towards change versus as the clinician, us kind of deciding that or assuming that for them. And so great questions for motivational interviewing of those such as, what does life look like for you in 6 months if nothing changes? Help me understand what this experience is like for you. How would you like things to be different? What are good things about this thing that you're doing? And what are less good things about it? So for example, I had a client who was abusing cocaine and came to me for trauma work. I'm a trauma psychologist. And so the person came to me for trauma work and we learned more about the cocaine use as we continued to work. And the person said to me, no, I really do. I do want to change. I want to stop using it. Interferes with my life. It interferes with my family. And so I listened to that and I validated that. And I also said, well, what do you like about using? And the person was kind of taken aback that I would ask what they liked about using. But we were able to have a conversation about some of the reasons that actually might push against them utilizing the skills that we talked about or moving towards change. So I think that's a really helpful question for pulling out ambivalence and really helping clients recognize the ways in which maybe there are some benefits to continuing to use cocaine, and for this example, but maybe the drawbacks are actually more than the benefits. And so when it comes from a client, that's much more powerful. As a skill-based intervention, DBT builds off specific goals. So no matter what the specific goals are, the goals fall into kind of two categories. We want to increase certain behaviors and decrease certain behaviors. And so when we're talking about increasing behaviors, we want to increase the behaviors that lead to greater emotional dysregulation, greater distress tolerance, and more effective communications, as well as more presence and a sense of self. We want to decrease any behaviors that are interfering with life and well-being. And so regardless of what, or in addition to what clients bring to you as behaviors to decrease, there are certain behaviors that DBT always includes as behaviors to decrease. And those are what are considered life-interfering behaviors: eating disorders, substance use, and self-harm or suicidal gestures are all considered behaviors to decrease, and those go on the list of goals that we want to shift and change. It's also important when you talk about goals to determine the triggers for the presence of these behaviors, as well as to figure out what reinforces these behaviors. Again, behaviors are not random, and behaviors that are reinforced continue. And so we want to know, here are the behaviors we want to increase and decrease. How can we reinforce the behaviors that we want to increase? How can we take away reinforcement of the behaviors that we want to decrease? Replacement behaviors must also be applied in relevant situations. So if I say, Dr. Green, I really would like to spend more time with my family. In the evenings, I'm very busy, but often what happens is after dinner, I smoke and my partner hates that I smoke. So I want to stop smoking. Okay. So I could say, all right, well then after dinner, just don't smoke. But that is not super helpful. It's probably more helpful for me to think with the client about replacement behaviors. So if normally the client finishes dinner and goes outside to the porch and has a cigarette and smokes for, I don't know, 10 or 15 minutes and looks at the stars, I might say, okay, so following dinner, what are some other things that you can do? What are some other behaviors that you can engage in? Okay, so you like being out at night and looking at the stars. Could you take a walk? Could you take a walk with your partner? Could you take a walk with your kids or with your dog? Could you do something else that brings that same sense of kind of relief or peacefulness or relaxation or creativity, whatever that feeling is? We don't just want to take a behavior away without considering a replacement behavior. New behaviors must be practiced. Old behaviors and habits became ingrained because they were practiced. And so the same thing is true about new behaviors. If we want our clients to engage in change, we have to encourage them to practice, and not only encourage them, but also really have a system of accountability so that our clients know that we're going to ask them about homework. We're going to ask them about practice, that their practice outside of their meetings with us is just as important as them attending session. It's important to anticipate when behaviors might be harder to access and to plan ahead for them. In DBT, we call this coping ahead. One of the ways to really set our clients up for success is to anticipate with them that there will be moments where they have difficulty accessing their skills, and that we can plan ahead for those moments. So we can think about, if you and your sister often fight and have conflict whenever you're around your mother, and we know that in 2 weeks, you all are going on a family trip, how can we anticipate that it might actually be difficult sometimes to use the interpersonal effectiveness skills that we've been working on? How can we plan how you might engage with common conflict that you and your sister have? Coping ahead and setting the client up for success doesn't make it more likely that they will be able to effectively use their skills, and they won't feel discouraged when it's hard for them to use their skills. It's also important to create the ideal goal and the minimum goal. So if we think about a client who is very depressed and has been in bed for 2 weeks, perhaps before they were in bed for 2 weeks, they used to be really active. They would work out 3 to 4 times a week. They had lunch with friends on weekends. They were an avid reader. They read books all the time. And they come in and they say, okay, Dr. Green, I'm ready to return back to that level of functioning. How many of us think that the client is going to just be able to return to that level of functioning just because they want to? Okay, I can't see everyone, but hopefully no one's hand is up. Because if this person has been in bed for 2 weeks, while that level of functioning can be a marker for us and can be an ideal goal, it's important to recognize that there might be some smaller goals that need to happen before they can return to that other level of functioning. And these are the things I call minimum goals. So if you've been in bed for 2 weeks, most of the day, nearly every day, then I want to know, can you be out of your bed for 3 days? Can you be out of your room for 3 days? Can we get out of bed, make the bed, leave the room? Even if you're spending 3 days on the couch, can we at least get out of the bed? Right? So we are thinking about what are the smaller steps that can eventually get us to getting out of the house and exercising 3 times a week. But what are the smaller steps, the minimum goals that can get us there? And we've already talked about the four main areas that DBT focuses on: increasing mindfulness, decreasing emotional dysregulation, effective crisis management, and increasing interpersonal effectiveness. I included it here again because whenever we're talking about goal planning and treatment planning, we are thinking about these four areas. We're keeping them in mind. The problem-solving technique. Fundamentally, clients always have choices about where they use the skills, how they use the skills, and whether or not they choose to use them. And I like to reinforce for clients that they always have a choice. One of the ways clients can make informed choices is by engaging in what we call a decisional balance, which is the pros and cons framework, which is when clients are able to really say, okay, the situation is happening. I can use my skills, I cannot use my skills. Maybe I feel ambivalent about using my skills. And so it's important for us to acknowledge that, to recognize when ambivalence is being triggered in our clients and how that ambivalence is impacting us. Sometimes clinicians feel very frustrated when clients present with ambivalence. This week they say, yes, I really want to get out of that relationship. And then a month later, we're still in the relationship, having the same difficulties and having the same conversations over and over again. That can feel very frustrating for clinicians. And so recognizing that ambivalence is a part of the process can be really helpful for releasing some of that frustration and also releasing our attachment to any particular outcome for the client. We also might ask ourselves, how does this ambivalence make sense? Maybe there are some pros to being in this relationship that the client is not aware of, or the client is not really letting us know about. And so even though the client comes in every week and says, I hate my partner, we have terrible communication, I don't want to see their face, it's still a month later and we're still in the same relationship. So something is going on, right? That is keeping the client connected. And so problem solving and introducing kind of pros and cons can really allow a client to recognize their own ambivalence, allow them to step back from the situations that they're in and be thoughtful about how they enter back into those situations if they choose to. And so the way you teach pros and cons is pretty self-explanatory and straightforward. You help a client to list what are the pros of using skills in a situation, what are the cons of using skills, and then walking out those pros and cons because we have an overarching goal. So maybe the pros of using skills in this situation is that, well, you are practicing a communication skill and it will reinforce your relationship. But a con might be, well, sometimes when you get angry, it feels good. And when you yell, like that feels like a release. And so you won't have that kind of a release. So maybe that con is a pretty compelling con, right? It's actually maybe one that could lead a client away from using the skill. Then you really want to think about, okay, now that we have these pros and these cons, what are our overarching values and goals, right? Which list leads us closer to those things that you say are important to you? The problem-solving framework. The problem-solving framework is one of my favorite frameworks in DBT because I think it's useful not only within a DBT intervention, but I really use a problem-solving framework with so many of my clients. I actually recently used the problem-solving framework yesterday with one of my clinical supervisees. The problem-solving framework says that we have 5 options for responding to a problem. It doesn't matter what the problem is, we only have 5 options. And each of the options requires different skill use, or in some cases, lack of skill. The very first option we have is to solve the problem. In order to solve a problem, you have to be able to correctly identify the problem. So if I'm coughing and I go to the doctor and I say, man, I've just been coughing and coughing and coughing, and the coughing is really waking me up at night, and I'm just coughing, coughing, coughing. And the doctor says, I know what's wrong. You've been coughing, and gives me cough syrup or elderberry syrup or some throat lozenges to soothe my throat and soothe my cough. But it turns out that I'm coughing because I have pneumonia. There has been a problem that has been identified, but it's not the correct problem. So in order to solve the problem, you got to correctly identify what is the problem. If you can't solve the problem, you might have to feel better about the problem. And in order to feel better about the problem, that's when we engage emotion regulation skills. Sometimes, though, we don't feel better about a problem and we got to tolerate the problem. The tolerating the problem comes in often when we are encountering something that we don't really want to accept, but maybe we don't have a lot of control over. And so that's when crisis management or distress tolerance skills come in, because we are recognizing that the situation might be causing us distress, but perhaps we can't do anything to change the situation and we can't actually feel better about it. So we learn to tolerate it. The fourth option is to use no skills at all. And that is often where we stay miserable. And we can choose to not use our skills and to stay miserable in a distressing situation. The fifth option is actually to make things worse. And so that's when we use ineffective skills or we use skills ineffectively. These options are always available to us as clinicians and to our clients. And so I thought we would take a moment and get into breakout groups of about 2 folks and engage with the problem-solving framework in our own lives. So you'll have about 2 minutes, maybe 3, to identify within the past month a problem, a challenge that you have encountered. And I'd like you to think about, in terms of intensity, right? If we're doing a 1 to 10 scale, 10 being this is like a really distressing problem, and 5 being right in the middle, I'd like us to kind of live somewhere between 3 or 5. So I'd like you to identify a problem or a challenge to your partner, to let them know how you handled it, and then to categorize how your handling of it within this problem-solving framework. So did you solve the problem, feel better about it, tolerate it, stay miserable, or make things worse? And so Stephanie, if you can break us into some groups. All right, if we could bring everyone back. All right, welcome back, everyone. Hopefully you learned a little bit about your own recent problem-solving methods and how skillful you were or maybe were not. And so one of the things I also appreciate about DBT is it really encourages clinicians to utilize the skills. And so even as we are teaching and talking to our clients about mindfulness and problem solving and interpersonal effectiveness skills, the onus is also on us to utilize those skills in our own lives. So mindfulness, when you think about mindfulness, do you know it as primarily a stress management technique, a pain management technique, or a way to contact the present moment? Okay, so most of us know it as a way to contact the present moment, and a little over half know it as a stress management technique. So mindfulness has been shown to be helpful with managing stress. It absolutely has been shown as very helpful for managing chronic pain, in some cases as much or even more than pharmacological interventions. But primarily, mindfulness is a lifestyle. It is a way to contact the present moment, not just in that moment, but from a perspective of understanding the present moment as where possibility is, where our values live, and where freedom is. And so when we think about mindfulness, we are calling upon particular elements: awareness, presence, and acceptance. And mindfulness defines awareness, presence, and acceptance in particular ways. And DBT defines mindfulness in particular ways. So we're going to spend time thinking about how DBT really defines mindfulness. So what is mindfulness? Mindfulness comes from Eastern religious and philosophical traditions that are rooted in Buddhism and yoga, but mindfulness in and of itself is not Buddhist. It is not a religious practice, but it is a practice that comes from particular religious traditions. Mindfulness can be thought of as a consistent work of attending to the present moment with full, non-judgmental attention, willingness, and responsiveness. And so the moment is a here and now orientation that I'm really thinking about, engaging with, and dealing with the moment as it is. Full attention means I am doing one thing at a time. So at this moment, I am talking to all of you. I am not talking to all of you and checking my email and writing my grocery list. I am just talking to all of you. So often in our lives, we are pulled in so many different directions. Our attention is grabbed all day long. And so mindfulness as a practice is the practice of you being in control of your attention, much more so than we often are. Non-judgmental engagement means that we are stepping back from evaluation. I referenced a bit before how judgment not only separates ourselves from other people, but it also separates us from us. If I'm spending my time judging whether or not I should be feeling a particular emotion, rather than working through the emotion, processing, living with the emotion, then I am somewhat wasting some of my time and my energy. Willingness. Willingness is really about having a sense of openness, openness to the present moment and openness to things as they are. Responsiveness. Responsiveness is about demonstrating flexibility. So I was reading a couple of years ago about the Dalai Lama. The Dalai Lama is a holy person that many, 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 many people visit. I think the Dalai Lama probably receives tens of thousands of visitors every year. And the Dalai Lama had written about an experience where a widow had come to visit him, and the widow was steeped in sorrow. And the Dalai Lama engaged with the widow from that place of sorrow and was able to kind of sit with that person in their sadness. And then the widow moved on, and a expectant mother came to the Dalai Lama and said, wow, we've been having so much trouble getting pregnant, and now we are, and we're so excited to welcome this future life. And the Dalai Lama was able to connect with that person in joy and expectation. The Dalai Lama was talking about and demonstrating a lack of attachment to any particular emotion in any particular moment. And that lack of attachment allowed him to be flexible and responsive. So he wasn't stuck in the sorrow of the widow, but he also wasn't stuck in the joy of the expectant mother, because there was someone else who was coming along the line, and the Dalai Lama needed to be available to that person. So when we talk about responsiveness and mindfulness, and in the present moment, we're talking about being able to connect to the moment and what's present in the moment as it is, and being able to let that go. Mindfulness is a foundational skill because we can't appropriately use the other skills if we are not in the present moment. And in this framework, mindfulness is meant to help with identity confusion, a sense of emptiness and dysregulation, as well as to increase connectedness. You can read about mindfulness, you can watch videos about mindfulness, you can have conversations about mindfulness. But if you do not practice mindfulness, it is very difficult to teach. It is very difficult to teach because it is deceptively simple. The complication in mindfulness is in the practice. And as clinicians, if we are not practicing, then we will be missing something when we teach mindfulness to our clients. This is a breathing exercise, but we're not going to have time to get to it, but it is present there. If you are interested in a couple of breathing exercise suggestions, I can send some to you. So in DBT, we have the what skills of mindfulness and the how skills. The what skills are literally, what are you doing? And the how skills are, how are you doing it? The what skills of mindfulness are observing, describing, and participating. And observing happens pretty comprehensively. So I often teach these skills to my clients and I ask them to demonstrate the skills to me. So I will say, can you observe the room? And many of my clients do this. And then they look back at me and I say, have you observed the room? And they'll say, yes. And I'll say, well, what color was the floor? And I'll say, I didn't look at the floor. And I'll say, well, what color is the ceiling? And I'll say, I didn't look at the ceiling. And I'll say, what about what's behind you? And they'll say, I didn't look behind me. And I said, well, then did you observe the room? And this is a really important lesson to teach in the moment because often we are only seeing a very limited view. And mindfulness asks us to expand our view. I use that example for external observation, but we also need to teach and train our clients to observe what's happening internally. So observe, and once you have observed, now let's describe. Let's describe what you see, what you feel, what you hear, what you taste, what you smell, and then let's decide about how you will participate. Mindfulness allows clients to step back from their judgments and their perceptions so they can meet the present moment as it is. And these 3 what skills are designed to help them do that. The how skills of mindfulness are 1, mindfully, non-judgmentally, and fully, completely, or effectively. So you want your clients to observe their experience 1, mindfully. That means singularly. I am observing my internal experience, and that's the only thing I'm paying attention to in this moment. You want them to describe their experience without judgment. So I'm observing that my heart is beating fast. I'm observing that I have a bit of shortness of breath and maybe discomfort in my head. So I have observed it and I have described it without judgment. I haven't told you my heart is beating fast and it shouldn't be, or I have a shortness of breath and that's so dumb, or I have a pain in my head and I always have a pain in my head because my body, something's wrong with my body all the time, right? So I'm describing non-judgmentally. And then clients get to decide how they would like to participate. And we want clients to participate fully and effectively in whatever the situation is. And so if they are fully deciding to leave a situation, then we need them to leave, right? Not run away and then shout behind them. That's not fully leaving. If they're going to enter into a conversation, that they enter into the conversation with their full attention, not talking and then I'm on the phone and then I'm doing this and I'm trying to have a serious conversation with my partner. So the what skills of mindfulness, right? Observe, describe, participate, and the how skills. You observe 1, mindfully, you describe non-judgmentally, and you participate fully or completely. The mindfulness skills, the how skills, and the what skills are really directing clients towards the 3 states of mind. DBT conceptualizes the 3 states of mind as kind of the 3 places where experience lives within us. And those 3 states of mind are emotion mind, reasonable mind, and wise mind. Emotion mind, that's the part of our mind responsible for emotional reactions. This is the place of love songs and poetry and emotional explosions. It's the part of the mind that keeps us connected to ourselves, to other people, and to our experiences. Without our emotions, we lose connection to meaningfulness in our lives. So when people say, let's take emotion out of it, first of all, that rarely takes emotion out of it. And second of all, we lose something when we just ignore emotions for the sake of logic. Reasonable mind is that place of logic. This is the straightforward part of our minds. This is where 1 + 1 = 2. It doesn't matter what the context is. It's the rational part of our brain that helps us to plan and organize, follow directions, and create strategies. It is very useful for problem solving, but a reasonable mind by itself can actually cause us to lack empathy and consideration for ourselves and others. Wise mind, however, is the recognition of emotion mind and reasonable mind, and it is its own thing. It is not just the melding of emotion and reason. Wise mind is where our values live. This is the state of mind that recognizes, I know that you felt very sad about that. And it makes sense that you would feel very sad about that and that you would want to throw something against the wall because you feel that way. Our values tell us that we don't want to throw something against the wall because we care about where we live. And it's important for us to have a safe and stable place to be. So wise mind, I think of as Yoda mind, which might date me a little bit, but it is the part of your mind that has the best advice for you, right? The wisest and highest good. and it requires us calling on our mindfulness skills. So this is kind of a visual depiction of how we can think about how these three states of mind live together. There are more advanced mindfulness skills. So beyond observing, describing, and participating, there are other skills that are useful when thinking about mindfulness. And one is compassion. Compassion has been translated as to suffer together or to suffer with. And to have compassion means to empathize with someone who is suffering and to feel compelled to reduce their suffering. And I think this is something that we often remember when it comes to other people, but don't necessarily remember when it comes to ourselves. That when we have compassion for someone else, we might say, oh, yeah, I want them to feel better, and I want to see what I can do to help them feel better. Self-compassion means that we suffer with ourselves and we also want to reduce our own suffering. And compassion really is the foundation for a mindful life, because within compassion, we allow ourselves to connect with other people from a place of recognizing that as human beings, we have universal experiences regardless of the details. And the more compassionate we become, the more we are able to become mindful. And the more we are able to become mindful, the more we can connect to our clients and help them through their journeys, as well as connect to our own journeys. The middle path often comes up when we are trying to make decisions between two really difficult and challenging places in our lives and choices. And the middle path is kind of right in the middle. It's where we decide, well, maybe I can't resolve A and I can't resolve B, but I can kind of carve out a lane for C. Balancing being versus doing. This is about recognizing that there are times where we are doing and we're busy and we're creating, and there are times when we're still. And being able to live comfortably in the place of busyness and also in the place of stillness. Radical acceptance. Radical acceptance is probably one of the most difficult mindfulness skills, because radical acceptance comes up when you're being asked to accept something that you don't want. This is when some of the larger existential life questions come up, the larger existential life challenges, when you really want something to change, but it isn't changing or it isn't going to change. And you have a choice to fight against what is true or to radically accept. Couple of pitfalls in our last minute. As I said before, I like to help clients plan ahead so they can anticipate some difficulties and challenges, and I like to do the same for clinicians. Sometimes clinicians underestimate the ambivalence of clients and they don't conceptualize its function for clients. And so they may become frustrated, or they may not recognize that ambivalence in and of itself can have a function. Clinicians can have difficulty maintaining the dialectical framework. Remember, acceptance and change. Clinicians might judge behavior rather than focusing on whether it's effective or not. It's not about how you feel about it or whether you agree. Is it effective or isn't it effective? Clinicians may not consistently reinforce the use of skills. Remember, behavior that is reinforced continues. Clinicians may recognize negative judgment, but not positive ones. Mindfulness isn't about not making negative judgments. It is non-judgmental, which includes the so-called positive judgments. Clinicians may not have a good grasp of mindfulness skills because they're not practicing it themselves, they don't teach them properly, or they miss correcting clients. And clinicians might blame clients for failing a treatment and don't recognize that clients cannot fail a treatment, but a treatment can fail a client. Clinicians might spend too much time with the problem of the day rather than focusing on the skills. I always tell my supervisees, your job as a clinician is to hold the thread of the therapy. No matter what the problem of the day is, there is a thread of therapy and it's your job to hold it. Clients may not practice skills or use them consistently or use them in situations where they're relevant. Clients might practice skills, but feel discouraged when the skills don't happen or don't give them the results that they want. And clients may also feel invalidated in session and pushed too hard to change. So these are some things to think about that might be barriers and challenges as you move into teaching your DBT skills. Unfortunately, I don't have time to answer any questions, but if you have questions, I would like you to send them to me. And I would also like to give you some homework. I'd like you to practice either implementing the 5 options for responding to a problem, practice the mindfulness skills, practice self-compassion, or notice the 3 states of mind. You can choose what you are going to practice. And as a matter of fact, when we send you out an email, you can also let us know what you're going to practice so we can keep you accountable. I think we're 2 minutes over. I apologize for being 2 minutes over today. I will see you next week. Hopefully, You'll have time to practice the skills between now and then. Please feel free to send along any questions. Thank you, thank you, thank you so much for being here. Hopefully I didn't talk so fast that it sounded like gobbledygook, but we will be back next week. Take care of yourselves.